My name is Tessier, and I'm a registered nurse at Norwalk Hospital. I'm semi-retired, and I work for diem a few days a week. I'm on the way to the gym, and I did get to the gym, and I did the exercise that I normally do. I usually do a treadmill for about an hour. Felt a little twinges while I was on the treadmill, different than I've had past days, but I passed it off as something that wasn't significant. Finished the exercise, I stopped and went into the locker room, and I did everything I needed to do and got myself dressed, and then all of a sudden I started feeling chest pain in my chest, and I knew that this wasn't something ordinary and it wasn't something that was going to go away. It seemed to be, as I was breathing, it would become sort of tense, and I knew something was wrong. So I knew I couldn't stay in the locker room, and I knew I had to leave the locker room because there was nobody else there but me. So I needed to get somewhere. So I got to their desk, and I sat down on the chair, and I thought for a few minutes, let's see what's going on here. Is this really happening? And so I went up to the trainers that were at the desk there, and I said, would you please call 911? I said, I think I'm having a heart attack. And I said, and if you have an AED in place, you probably might get it. And so, surprisingly, they were very, very calm. They didn't do anything of any alarmist way that would change the environment or the people around them. And they picked up the phone and they called. And the first responders were the Westport people that came in, and they put some oxygen on me, and they took my pulse and trying to reassure me that I was okay. And then the hospital ambulance arrived after that. And in fact, I walked to the ambulance and then put on a stretcher within the ambulance, and they put me up to Leeds and realized that I was just really having an event here. And so they had me choose some aspirin, and after that they started an IV. They continued to talk to me, and while I was there, it was all happening. It was getting stronger, the pain was getting greater, I was becoming more uncomfortable. So I know they relayed from the ambulance to the hospital that I was coming. And I arrived at the hospital 8 minutes later. I was within the emergency room, and there was a team that was waiting for me. And they did all the things they needed to do. They got information, was able to notify my wife that I was in a situation like this. And then from then, we went from the emergency room, we went down to the cath lab, and in the cath lab, within 15 minutes, they were able to open up 3 vessels on the left, and it was a remarkable change. It was totally something totally different than I've ever felt as far as a physical kind of feeling. Everything opened up like like I was breathing fresh air, and like I was taking it into my lungs with a lot more clarity, and which it wasn't like that beforehand. In fact, I would feel my present state in the couple of days leading into that was telling me something that wasn't right, and I wasn't responding to it all. No, one of the good things, I was I was under the right star that day, because they were going to do an in-house case, and it just happened to get a call in at the same time that I was on the arrival, and they sidestepped that case and was completely set up for that case, but that case became me. And so it took them less time to do what they needed to do in my situation than they would have in another time. They brought me up to the ICU, and within the ICU they hooked me up there, and they were giving me meds and stuff like that, and they were really doing a good job as far as taking care of me. After I was discharged, I didn't go directly home. I went to another hospital. They needed to open up a vessel on my right, which they couldn't do within the hospital because they're only qualified for emergent situations, and so this was non-emergent. So I went to another facility, and they opened up the other vessel. I was there for 24 hours, and then I returned home. after that. And then I went through cardiac rehab, and cardiac rehab was the best thing that could have happened to me. To have an assault on your body like that, it makes you mistrust yourself and mistrust what your body's going to do to you next. And it was really kind of fearful because I couldn't reconcile the idea that I was alive. I couldn't reconcile the idea that I could have not been that way, and I still couldn't believe that I was still walking and functioning and doing the things I needed to do. And so cardiac rehab gave me that reassurance that even though my body betrayed me, that I was going to be okay, and that I was going to go forward, and I was going to be being able to resume my life. I received rehab at Norwalk Hospital. Then I saw my cardiologist probably about 4 days later, and he was able to evaluate as far as what was going on with me, and then took more cardiograms and was able to give me the medicines and the things that I needed in order to recover. It's been a year later, and it's taken me, you always think along the way that I'm okay and I'm through this and everything is fine. And it really honestly takes a year for you to mentally get strong again and to realize that you're okay, and to know that the medicines that you're taking are necessary, that you need to take them in order to make your heart function. And me being athletic most of my life, I never thought myself as being would ever be a heart patient. And the history that I have an identical twin who had the same thing 6 years previous to me in the same vessels. So, and at that time I was so frightened by it, I had my cardiologist do a stress test with me and found nothing at that point. So it's a family history that brought me down this path. The activities I do are non-restrictive at this point. I'm basically at the same level I was before my heart attack. I go to the gym at least 5 out of the 7 days, and I run on the treadmill for about an hour. The prognosis for me is that I will be a normal, healthy individual for probably the rest of my life without any real big cardiac issues. I participated in the Heart Walk because I feel like I need to give something back. I feel like I'm very fortunate to be healthy and alive and have a great strong heart and a good future for myself at this point. The Heart Walk means that I'm going to at least express to everybody else around me that it's necessary to give that extra, and to be able to realize that this is something that is very important very important to be a part of. I'm going to try to mobilize a lot of the nursing staff within the hospital. I'm the team leader for the nursing staff, and an interesting name will be Fred's Friends. That will be the name of our group that will be participating in the Heart Walk, and I hope that I have a great response. The only thing I would say, if somebody who might have a life experience like my own, is to listen to your body and know that this is something different, and that to address it, whether you think it's not something, or whether you think it is something or not. Norwalk Hospital played a significant role in the overall of my recovery, from the beginning all the way to the end, to the present day a year later, and I will continually feel fortunate that I've been a part of it.